Hello again. This is Mark Mazzaferro, Communications and Media Officer for the City of Vacaville. We're back with another live update on what's happening in the City of Vacaville regarding the COVID-19 pandemic. And with us, as always, is Fire Chief Chris Concepcion. Chris, thanks for being here.
No worries. How you doing, Mark?
Doing well. I had a quiet weekend at home, as I hope everybody did. But today we're going to talk about two main topics. One has to do with peaks and valleys regarding the coronavirus crisis. And let's kind of keep it focused on just as local as you can.
Sure. So everybody's been reading about the peaks, and it's been mentioned on the news a lot. And you hear Governor Newsom talk about it. And here in California, as well as here locally, they're expecting the peak of the number of cases and demand for hospitalization for COVID-19 to be somewhere near the end of April, and they're pinning it to either April 26, 28, depending on where you read and what you see on TV.
Now, what does peak mean? Are they talking about the number of cases, or explain peak to us?
And so what they're talking about as far as the peak is, yes, it's the number of cases. So you're going to see, and it's going to see an increase every day up until then, and then it'll come down. Now, a couple of things that I do want to say about that is, a lot of people think, oh, okay, the peak is, if it's on April 26th, woohoo, we're good, we're through. That is absolutely not the case. And so what they're talking about, the peak is when we will have the highest number of cases, and that's when you'll see that the additional cases will start to decrease, or they think that's when the additional cases are going to start to decrease. That doesn't mean that all of a sudden COVID-19 is gone and we can return back to our normal lives. What this means is it'll just start slowing down, and we need to continue with our good practices that we've been doing.
Right, and despite lots of optimism about getting things back to normal, I mean, it's going to be and I'm no expert, but it's going to be a while before we can say, yeah, okay, we are back to where we were January 1st, for example.
Yes, and that is very true. I mean, you can't just. It's not going to be one of these things where all of a sudden, we just start doing everything and go back to what our normal lives. I mean, I foresee in everything that I've read and I've watched and heard, I foresee kind of a gradual return back to what our normal is. So it's going to be months.
Now, you mentioned this in our briefing a few minutes ago. We talked about the peak and how it's different in California than it is in other parts of the country. And one of the main reasons for that is?
Yes, so I think in California, we were one of the first states to have a shelter-at-home order, and that is and I think California has done a real good, including Vacaville, has done a real good job, really, of flattening the curve, and that we haven't seen that huge spike. I mean, it could have been, I think, a lot worse than what we've seen here in California. I mean, you've seen what's happening in New York, and they're obviously in tighter quarters than we are here in California, but here in California we've got a larger population, and we've got just about 1/10 the number of cases New York does.
And that's good news.
Yes.
Now, last Friday at 1 o'clock or so, we talked about an impending announcement regarding masks.
Yes.
And sure enough, that afternoon, the CDC announced that they're recommending people wear masks when they go outside. Let's talk about masks.
Let's talk about specifically what the CDC guidance is. The CDC guidance and recommendation is that people wear cloth coverings when they are outside.
Right.
Okay. And so due to the shelter at home orders, the only time you should be outside is if you're going to get food or if you're seeking medical help, right? And then the other thing too is if you're trying to get some exercise. What they're finding out, and so what they're recommending, and did you post it on? You posted it on our website. So
it's at the top of our COVID-19 page.
So there's a link there. Dr. Jerome Adams from he's our Surgeon General, right?
Correct.
He's the Surgeon General. He actually has a quick video on how to make a cloth covering out of regular household items that you have. 2 rubber bands and a handkerchief is all you need for what the CDC is recommending. So they're recommending anytime you go outside, and if you're you're at the store or you're at the pharmacy, then go ahead and wear these cloth. I'm going to call them cloth coverings because the masks, the N95s, the surgical masks, and things like that need to be really reserved for healthcare workers and first responders because the healthcare workers, first responders still need that personal protective equipment because they're on the front lines of fighting this thing.
Correct. And again, it's not a mask, you're right, is the wrong word. The word is a facial covering, something to cover your face.
Yes. And the reason that they're saying this is as they're getting more and more information about COVID-19, they're finding out it used to be that they would say that the people that didn't have symptoms of COVID-19 did not, even though they were carrying the virus, did not shed the virus just minimally as compared to someone who had symptoms. So the cloth coverings, and now what they're finding out is that people can shed the virus and can spread the disease unknowingly because they don't have the signs and symptoms of COVID-19. And so what the cloth coverings do really is when you go outside, it's keeping you, in case you have COVID-19, it's keeping you from spreading that to other people that you're around. It's not preventing you from getting it from others, if that makes sense.
Correct. Yeah, right. That's the thing. I think it gives the idea is what you just said. It's not that it won't prevent you from getting it. It keeps you from spreading it.
Yes.
To put it quite simply.
Yes. And one thing that I want people to remember is the mask or the cloth coverings, whatever you want to call it, is no replacement for the good hygiene and the social distancing practices that we have in place right now. It is very important, and that's right there in the CDC website, is you can't forget about these things. I mean, don't get a false sense of security now that you're wearing a mask. You're not going to get COVID-19. Remember that the cloth covering that you put on your face is keeping you from spreading it in case you have it. It's not keeping you from getting it in case somebody else has it. I mean, the droplets can still be on the tables and the doorknobs and all that. So keep wiping those surfaces down. Use hand sanitizer. Wash your hands for at least 20 seconds. Don't touch your face. The one thing that, having had to wear a mask, sometimes because, in my line of work, it makes your face itchy sometimes. It reminds you of how much you touch your face. I mean, that is the one thing you can't touch stuff and then touch your face. You can't do that.
I think I read somewhere that on average, people touch their face between 25 and 35 times a minute. Or an hour. I don't remember.
I wouldn't doubt it.
But it's a lot. I find myself doing it all the time.
Yeah.
And it's a struggle for me. But,
yes.
The consequences kind of outweigh the struggle. So
yeah.
Anything else you want to add today, Chief?
Yeah. The one last thing is I got a couple of complaints over the weekend, and then as I was out and about, I noticed it also. Is that Vacaville, we're better than this, but I've noticed that I've seen some, people are using gloves now, to protect themselves. But the problem is they're just tossing the gloves wherever, they end up, when
they get out to the
wherever
car
they end up. Before they get in the car, they toss it right, where their car's parked into the parking lot. Well, let's keep Vacaville beautiful. Let's, pick, either put it, have a trash bag ready in your car, or there's trash cans available in most of the parking lots in Vacaville. But let's not litter. Let's keep and remember that you dropping this stuff, someone's got to pick it up, right? And so that could be another way that that you unknowingly spread COVID-19, and we don't want that. So help us. Number one, keep Vacaville beautiful, but also let's keep Vacaville healthy by picking up after yourself.
Good deal. Thank you very much for the information, Chief, and thank you all for watching. Remember, if you have a question, send us an email, cinfo@cityofvacaville.com. Thanks for watching. We'll see you again.